Good
We're
evening,
live.
Yes. Good evening, Cobb County. This is Chairwoman Lisa Cupid, and I appreciate you tuning in to our first town hall meeting of this new year. It is my desire that yours is a happy and healthy one, but still we all know that remaining healthy has remained fleeting for far too many at this time. Since last year, December, we have been experiencing rapidly rising COVID numbers that continue to go through the roof. Also, we're observing our medical facilities begin to teem with patients again. Not only have we seen the surge in numbers and in our medical facilities, but even on our roadways as persons line up for many testing sites across the county and metro area. Certainly, the impact of the pandemic is still with us. This is why I felt it was important for us to have this town hall to address the continuing impact that COVID-19 is having on all of us. But I'm pleased that I'm not here alone. Today with me is Dr. Janet Memark, who is the director of Cobb Douglas Public Health. And I'm also pleased to have with me today Dr. Brandstetter of WellStar, as well as Stephen Vald of WellStar. We hope that we're able to help answer your questions and provide clarity as we try to get through this once again, this new year of 2022. With that, I'm going to turn things over to Dr. Memark.
Thank you for having me here, Chairwoman. And I'm going to do a COVID update, and there's a lot of information here. And I'm hoping that the county can share it with our residents so that you have it accessible to you as a reference as we continue to navigate this pandemic. So, okay. All right. So, okay. So we're going to first just take a look at our numbers. And so we are at a very high 2,626 cases per 100,000. That's a 2-week case rate. And just to remind you, high transmissions are considered 100 over 100,000. Now, the good news maybe for the last few days is that we've had it come down the last few days. So we're hoping that this is a trend and will continue in that same direction. But we should know over the next week or so. Our positive percentage rate is 32.8. We want that less than 5%. And before this last surge happened, we were like at 2 point something and change. This number has also come down a tiny bit over the last few days. So we hope, once again, that's an indicator we're going in the right direction. But almost a third of all those PCR tests are coming back positive right now. I wanted to show you some of the graphics from the Department of Public Health that shows cases by vaccination status. And you can see that the people that are unvaccinated make up a big proportion of folks that are getting COVID. And you see our fully vaccinated folks that are in the middle, and then you have the fully vaccinated with a booster at the bottom. So still unvaccinated folks are still being hit by this Omicron variant as well. Here are our hospitalizations, and when you take a look at Georgia, we are hitting close to the highs that we've had over the last surges. And there has been a slowing, but even this week, continue to have an increase throughout the state. At the top, I added from the Georgia Coordinating Center. You can look every day at our hospitals that are in our county and see how their statuses are. And so Kennestone remains to be very, very busy with having intensive care diversion as well. And that was this morning, though. Here's the hospitalizations also by vaccination status, and you can see that we're still looking at unvaccinated folks making up the majority of folks that are being hospitalized with COVID. And if you get that, if you're fully vaccinated, you get more protection, and then if you get the booster, you have even more protection. And it's very few folks that are actually hospitalized that have been boosted as well. When you look at deaths, we are very grateful that this time around we don't have as many deaths, but the deaths that we are seeing, we have had a little bit of an uptick this week, and this is probably from the lag in reporting over the holidays. But once again, it's mostly unvaccinated people that are succumbing to COVID-19 and the Omicron variant. Here's that picture of what the Omicron variant has done to us over the last few weeks. And so before all of this, we were talking Delta, 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 and Omicron made its presence in a big way. Now we're at about 99% of all our cases that are being sequenced are Omicron. Here's our vaccination numbers. So, you know, Cobb County has been doing pretty well compared to the rest of the state and our neighbors in terms of vaccinations. We have one of the highest rates in the state at 64% with the first dose and fully vaccinated 59%. Here's where the problem comes in. When you look at the bottom right corner, our booster dose is only 22%. And so it's very important that we continue to get our shots and make sure you get boosters. Everyone 12 and over is eligible for a booster. So it's important that you go and get it. I included this graphic because it can get very confusing. So you go ahead and look at where you are and which shot you received, how old you are, and you can determine when you should get the booster. Right now, they lowered the time to 5 months after your series, and it's 2 months after a Johnson & Johnson. They are recommending if you receive the Johnson & Johnson that you go ahead and get a Pfizer or Moderna as your booster to give extra protection. But anyone 12 and over can get that booster shot. Anyone, and this is not conditions and things like that like we have previously had. Okay, this is another confusing topic, and this has changed so many times. I want to make sure you all had all of this information so that you can look it up as well and see where you fall, because I'll show you and then we'll all forget and we need to go back to the references. So for quarantine, to calculate quarantine now, if you were exposed and not up to date with your vaccinations, that's including the booster shot, you quarantine for at least 5 days, and then you make sure that you wear a mask. After quarantine, you watch for any symptoms. If you have any symptoms develop, you have to start this whole thing over. But making sure you have the mask on is very important. And get tested at day 5. So this is very important. This can be very mild to no symptoms, and you can be unknowingly spread it to a lot of people. Omicron is highly, highly contagious. It's milder, but man, it makes up for it because it can get so many people sick. And here's the rest of the quarantine guidance. If you were exposed and up to date on all your vaccines, you still don't have to quarantine. You do need to take a precaution and wear your mask and still get tested, but at least you have a little bit more leeway. And if you were exposed and had a confirmed COVID-19 in the last 90 days, you don't have to quarantine either, but still take your precautions. So isolation, this is the one that has changed a whole lot just recently. If you test positive or have symptoms, regardless of your vaccination status, you must stay home for 5 days and isolate. And then after that, if your symptoms are pretty much better, you don't have fevers, and you haven't needed to have many medications in the last 24 hours for fevers, you can go ahead and end isolation and wear your nice fitting mask after that, okay? If you have severe COVID, that's a different story though, and you really need to isolate until your symptoms have improved. And that's 10 days, okay? All right, so who should get tested? This is with all the testing sites now and the lines that we had, this is a big question. So, if you had any symptoms, for sure. And I've told people this before, before when the case rates are low, and you said to yourself, oh, I have a runny nose or I'm sneezing or something like that, and you say, okay, maybe I think I have allergies, maybe that will fly at that time. But right now, because we have so many cases, over 2,600 cases per 100,000, you should think COVID-19 first. Go ahead and rule that out. Don't go and say to yourself, I just have allergies, because I can't tell you how many people came back with COVID after they said that, and then they were out and about, okay? If you become a close contact, that's 6 feet within for 15 minutes, then you need to think about it as well, get tested, okay? And if you're not on your vaccines and up to date, and you need to have some screening, that's also as well. And then if you've been asked to take one by your health authorities also, okay? And a lot of people need it for work and travel. There are other reasons that people need to get that test as well. There are several different kinds of tests, and I was told that there's a lot of confusion about this, so I want to make sure we went over it. the PCR or the nucleic acid amplification test, that is still the gold standard. It detects any genetic material or nucleic acids in your secretions that is collected, okay? Now, because it's a very, very sensitive test that picks up genetic material, having a false positive is unlikely with this one, okay? Or so if they get something, it's usually you still have some genetic material left. So it's more sensitive than those at-home and Anagen tests. Now, the issues here is you can have that test be positive sometimes weeks and months. That doesn't mean you're infectious though, right? And so that's kind of one of the drawbacks of this test. And the turnaround time, it can be a few days. So those of you that have tried to get PCR testing now, it can be, you can get it the next day, or you can wait several days. And that means you don't know if you were positive for several days. This is what's in vogue now, the rapid test or the Anagen test. You can use those when you have COVID symptoms or you have been exposed to somebody. You can use that test. Other people use it sometimes when they're going to go gather with a lot of folks or go and meet people that might, like, you know, older relatives, older friends, or people that may be unvaccinated. A self-test might be helpful to give yourself a little bit more confidence that you're not actively infected with COVID. Now, a negative test, it tells you that you may not be infected and maybe at low risk of spreading it, but it's not 100%. So you got to remember that, right? What increases that value of that test is to be able to do it again after at least 24 hours. Things that you should remember though, if you get a negative test and you got full-blown symptoms and you were in contact with people that had COVID, I would be a little bit leery of taking that result. I would probably get a PCR to confirm that one, or take it again in a few days. And I have seen many, many, many come back positive when repeated. So that positive test means that the test detected a virus for you, and that you should isolate and go under those isolation guidelines, all right, for the 10 days or 5 days, and then wear your mask if you're improving. The negative test, we had talked about that before. If you're in a low risk situation and your test comes back negative and you don't really have symptoms, or you were at low risk, you were at home and you didn't have any exposure to anybody and you got symptoms, then maybe your negative COVID test is truly negative. Now, if you were out and about and you were in a concert and a lot of people were sick and you come up with symptoms a couple of days later, well, I would really think twice about that. You might have to repeat it or go ahead and get a PCR test. The antibody test is a completely different body of tests. I want to make sure everybody knew what those were. And so this is a blood test that they take, and they look for antibodies, which are parts of your immune system that help you fight infection. Now, it's not going to tell you if you have a current infection. It can, but it's really to show if you've had a past infection or had exposure. And sometimes certain antibodies can come back positive even when you've had your vaccine. So it's kind of important to, do this with a healthcare provider because it's easily misinterpreted. And here's the differences, so you all can take a look at that. The rapid test is quick, 15 to 30 minutes. It's great, but not as sensitive. So there's just things to think about when you are weighing which test to get. Okay, and you can have all of these available to you so that you know. And then here's a different graphic if you want to look at a different way to look at this. I like to present things in different ways that folks have different ways that maybe will click with them. Okay, COVID testing. All right, so Jim Miller Park is open again. So we're back over there, and we're very appreciative to the chairwoman and the county for helping us to do this in quick order. We had a line of cars immediately that started, and there's viral solutions out there. So we continue to we have some really good testing options here in Cobb County. Our Wellstar partners, we're grateful to them too. They have the East Cobb location, 7 days a week. They're offering tests. And we have the Riverside Epi that has 2 days right now, and they're going to be expanding to 5 days very soon. So South Cobb will have more options for testing. So we're grateful to our partners at Riverside Epi as well. KSU started at BrandSmart, and they are 7 days a week as well, and grateful to the KSU folks for helping us out. And like we said, we got Jim Miller Park 7 days a week. So This is all PCR testing that's being done, and it will be done at no cost to you, but if you have insurance, then that could be billed. All right. And some other things, we had Six Flags tickets that we were able to give out. We're very excited. We did that, and we're almost done with that initiative, and grateful for that. And we've been doing a few things with our community partners just to show that, you know, we have a grant that we had gotten, and we're doing work with Morehouse to have community health workers to go out and educate, and then working with the Center for Family Resources as well to do a lot of outreach and assistance to our residents. All right, so I want everybody to take away, please, 5 and over, get vaccines, COVID vaccines, very important. 12 and over, get those boosters. That is gonna give you the most protection right now. And get your test if you are questioning whether you have it. And remember, the one thing that works against all the variants is, first of all, avoiding large crowds, right? Wearing a mask, a well-fitted mask is very, very important, and washing your hands. This is not going to be forever. We just need to kind of bring this down over the next few weeks, and then hopefully we'll be well on our way back to normality. And that's all I have. So I think we have some questions for everybody.
Thank you, Dr. Memark. We also are pleased to have Dr. Brandstetter with Wellstar with us today. And we'll go ahead and hear from him before we dive into any questions.
Good evening, everyone. Am I coming through?
Certainly are.
Excellent. Thank you, and good evening, Cobb County. Chairwoman Cupid, thank you for the invitation to join this important town hall. We are once again gathering to discuss the virus COVID-19 as it continues to wreak havoc on our lives and provide disruptions for us, as we're dealing right now primarily with the Omicron variant, as you've heard from Dr. Memark. I'm happy to partner alongside her tonight to provide more information about this virus, particularly what we're seeing in the healthcare institutions within Cobb County. So as this continues to spread, one of the biggest things we saw within the healthcare institutions were a significant rise in the number of hospitalizations with COVID-19 positive patients. The Omicron variant has shown us one distinct difference than the previous surges, is that we're seeing a lot more people admitted for other medical issues that do not bring them to the hospital for COVID symptoms, but subsequently test positive for COVID. That's a benefit, so then since they're not needing hospitalization for the COVID-19, but we're all seeing that concurrent infection at the same time of hospitalization. So the other things that we're seeing is a significant impact on our access points for healthcare. That's our urgent cares, our primary cares, and our emergency rooms. So patients who are experiencing true medical emergencies are experiencing long wait times to access care. One of the things I want to bring up to the community is you may be hearing about the deferrals or diversion statuses that hospitals go on. One thing I want to stress is that does not mean the hospital's closed or the ER is closed. We're still there to care for patients. We're still there, want you to come and get there to be seen if for medical emergencies. Well, the intent of that diversion is to help emergency medical personnel direct people that have a medical emergency to the quickest location they can get the most appropriate care and the most appropriate level of care. That's more of a how do we direct patients in a capacity flow than it is a close. The hospitals never close. So we want you to know we're open and helping care for you. The personnel is our big impact. As we've talked about, this is nationwide. Healthcare personnel is our biggest resource limitation that we're experiencing across the nation. And with the Omicron variant, our healthcare personnel are not immune to Omicron impact as well. So we're seeing several people ill at once from Omicron as well. And you heard the numbers vaccinated, boosted, and unvaccinated from Dr. Memark, what we're seeing throughout our communities, and how rapidly that Omicron is spreading and how easily it is transmitted. So my plug is to, once again, do not relax on the safety measures. Be mindful when gathering in groups. Please take the precautions, 3 W's you've all heard about, and by all means, stay up to date on your vaccination status, including being boosted if you're 12 and older. So some specific numbers for the hospitals. we are now seeing some of the largest numbers that we've seen throughout the pandemic. As of this morning, we had 808 patients who tested positive admitted to our hospitals. And the majority, just like we're seeing in our communities, the majority of those are the unvaccinated. Over 70% are unvaccinated. We do, in this particular variant, Omicron, seeing significantly less ICUs and ventilator use. For example, some of our largest surges, we were seeing 100, 150 people requiring ventilators. We have 63 as of this morning requiring a ventilator if they were COVID positive. So that's a significant difference we're seeing with the Omicron variant. But again, being unvaccinated is your biggest risk factor to requiring that level of care in the community. So being vaccinated is our best protection still. Can't say it enough. These numbers are doubly verified from two very different sources. Just if there's a curiosity how we come up with that number about COVID positives on the ventilator, and that is the number requiring it because of COVID infection, not for another indication. So you've heard about vaccines, the boosting recommendation and the efficacy that it has. And remember, the vaccine primarily is there to prevent us from having severe illness, hospitalization, and death. So we do anticipate that most of us will get exposed to COVID-19, have some form of the illness because COVID is here to stay. The vaccines are there to make it a nuisance, hopefully no symptoms at all, but a short duration of illness and back to our lives is the hope that the vaccine will provide us that protection and accomplish that for us. The treatments that we have available, so you've heard about the supply of the effective treatment of the new oral antivirals. We're seeing that in the state of Georgia. We're seeing it in our pharmacies available in multiple locations, but the supply of those is still pretty limited. Hopefully the next couple of weeks that will be alleviated and we'll have that more readily available to our community. I want to remind the communities that this is not a panacea. That means that it is not a cure-all for everyone. There are some medications that interact with these drugs and cannot be taken at the same time, so some patients can't qualify for that. It is not approved for pregnancy, and want to make sure that it's used within the first few days of illness. That's when it's most effective. So these testing locations, getting tested, like Dr. Memark went over, is important to know. Talk to your healthcare providers. Use a virtual visit if you can't get into an urgent care or emergency room, or your primary care. Virtual cares can also help get you linked to those prescriptions as well and treatment that's most appropriate for you. I want to remind people that if you're just seeking a test, try not to go to the emergency room just to get a test. Use one of these other testing locations is what we're trying to guide people to for the most appropriate level of care. The other thing that I want to briefly comment on is at-home testing. Some of the testing numbers that we're seeing and the high number of positivity within our community is probably an under-reflection of the true numbers in our communities. At-home tests are not included in these numbers. People who are positive, one member in the family, another member comes down with symptoms, don't test, they just assume that they have it, which is a really good assumption. They probably don't get tested and they recover without that contributing to our numbers as well. The type of test, Dr. Memark did an excellent job of going over those for you as well. The one thing I do want to remind people is that while we submit a bunch of samples to the state and CDC for testing to determine the amount of different variants and look for new variants that may be in our community, we are not able to tell patients which particular variant they do have that is not part of the regular standard routine testing that's available. That goes to specialty labs within the state and the CDC for testing. The treatments, other treatments for Omicron and other variants that we have are monoclonal antibodies. We're getting increased supplies of those. We are using our urgent cares right now to provide that at select locations, and we're doing it based on the tiers of priority from the NIH and CDC based on guidance for those, prioritizing those for the highest risk of progression to disease. And as we get more supply, we are excited about being able to expand that more and more, and so thankful for our state officials and public health officials for helping us get those and offer those to our patients. I can't stress enough prevention, prevention, prevention. It is a combination of tools that we use to do that. It's the 3 W's. It's being fully vaccinated plus boosting, and then being mindful of the groups you gather and the safety measures you take within that. And even testing, pre-gathering large groups to try to reduce the risk of those. And if you are testing positive, avoid gathering with crowds, stay home, do the recommended isolation, and please wear a mask after your 5-day isolation period, as the new recommendations are. In addition to the healthcare personnel shortage that we're experiencing throughout healthcare, our nation is experiencing a blood crisis, and that is the blood products availability. I want to give a plug to the community. One thing you can do to help out, a lot of times there's frustrations because people feel like there's not much they can do other than control, like whether they're wearing a mask and being vaccinated. Here's another item which you can do to help out communities and people who may need blood products for surgeries, people on chemotherapies or with underlying diseases that require blood transfusions, platelets, etc., is donate blood. We need blood donations. We're at critically low levels of all blood types. So if you're able to give and donate, please schedule that to be done. That is one thing that we can do for our communities. And in closing, I do want to thank you for your humble and so grateful participation in these meetings and your working with our healthcare providers as these wait times are experienced by all and can be very frustrating at times. But thank you for working with us on that and your understanding and your patience. But we want to make sure that you understand we're there to care for you. Please access us if you need us in emergency care. Keep your regular scheduled appointments with your provider. If you feel unsafe getting out in public because of the high numbers in the community, please schedule those virtual visits. Make sure you stay on your medications and keep healthy as possible. And with that, I'll turn it over to our VP of Strategic Community Development, Stephen Balt.
Thank you so much, Dr. Brandstetter. And I just want to thank you for letting us provide an update based on WellStar's COVID response. So we're grateful and always are to continue to work alongside the county officials to address the needs in the community. Just want to thank everyone on this line who has supported WellStar in our communities throughout the 22 months. WellStar has been dedicated to providing COVID community updates and resources, and those resources can be found on our website at wellstar.org/community/COVID-19. There you'll find recordings of every community briefing, the latest being in December, and you can see other resources there as well. So please check that out when you get a chance. Want to thank our DPH partners for continuing to work with us on testing sites. As Dr. Memark talked about PCR testing, that's available at locations across Cobb County, and it's free, but with insurance, you could be billed. WellStar partners specifically at our East Cobb Health Park location, located at 3747 Roswell Road in Marietta. On average, we're seeing 15 to 170 tests daily, which is down from the approximately 350 that were being done earlier this month. But testing is available 7 days a week, and while pre-registration is encouraged, it is not required. And so we continue to appreciate that partnership with DPH to make sure the testing resources are available in the community. WellStar is also very thankful for the support of the Georgia National Guard as we continue to serve our patients and community during this current surge of COVID-19. The National Guard members have been approved to support our frontline caregivers across our system, including at WellStar Kennestone Hospital. In addition, here at WellStar, our congregational health network team has held about 70 pop-up vaccination clinics since April 2021, with the most recent being in coordination with Cobb Douglas Public Health and held at Pleasant Grove Baptist Church and was a booster clinic. So again, we remain completely committed and thankful to our community partners for the work in helping us not only test, but vaccinate and boost our community. There are a number of different spring initiatives that we're planning across the system, because while we know that COVID has been the major concern, there are things associated with COVID that we just can't get around. One of those that has been exacerbated by this pandemic is food insecurity. So we're planning several mobile market events in Cobb from March through June to offer fresh nutritional food items with a dignified shopping experience for our underserved populations. Through our WellStar Center for Health Equity and in partnership with our WellStar Foundation, Gooder, and the community-based organizations, we will continue to serve the community through these WellStar mobile markets. So look for more information on that. It's important to note that we cannot do this important work without all of you on this call. And a special thanks to all of our county officials. Thank you for the ongoing partnership. We're grateful for the ongoing collaboration of our Metro Atlanta health systems. WellStar has once again joined together with 5 other health systems to share a message with the public on ways that we can protect ourselves, ways that we can get through this surge, and that is being shared locally with news outlets, and just want to make sure the community is well aware of that. In closing, thank you again, Chairwoman Cupid, for inviting WellStar to provide this update. We continue to remain committed to helping the community as we get through this. Thank you.
Thank you, Stephen. Appreciate your remarks. Dr. Memark, Dr. Brandstetter, thank you also for providing us medical insight as to how we can best protect ourselves and understand the data surrounding COVID-19 and also the results and the medications that are associated with COVID. As things continue to change every day is how we respond to this. Dr. Branstad, I also appreciate you letting us know how important blood donations are at this time. It's hard to consider some of the ancillary impacts of COVID when we're dealing with the pandemic in our face, but certainly as this is impacting so many aspects of our lives, it's understandable how it's also impacting blood donations. And so that's something that we can help to encourage at the county. With that, I'm pleased to say that we have been assisted tonight to be here virtually because of dedicated staff at Information Services. They are going to help guide us through questions that many members of the public have provided to us. And so, Yolanda, I'm going to turn things over to you so you can help to inform us about questions that you've received.
Thank you, Chairwoman Cupid. I'm glad to be here tonight to help facilitate the meeting for you. We did receive several questions from the public, and first I'd like for you to address some of the questions, Chairwoman. They were actually directed toward the school system. I think in general, people sometimes have some confusion between Cobb County schools and Cobb County government. So in general, would you help our audience to understand the relationship between the school system and the Cobb County government with regards to tonight's town hall? And beyond that, if you could, as a parent, speak to how you are navigating this situation as a parent with children who are school-aged children. I think that would be helpful to kick us off tonight.
Thank you. I appreciate that. Cobb County government and Cobb County schools, we are 2 separate governmental entities with 2 distinct jurisdictions. So even though we both have responsibility for serving the public at large in Cobb County, neither one of us have jurisdiction over the other. I'm pleased that we are providing this COVID update. However, any information that we provide here tonight is to inform you as a citizen, with hopes that you would use that information with respect to the care of your family and your children. As Yolanda did state, I do have 2 children of school age who I believe are as concerned about this pandemic as I am. And, they are cautious in how they interact with their peers. And so for me and my family, my children continue to go out masked, and we go out masked with our children as we want to keep them safe. And this is not something that we have to remind them of. This is something that they initiate because they do not want to be ill. They've experienced, as many of you have, several of their classmates, some of their teachers being out of school because of the pandemic. And I think the nearness of that to them gives them more reason to make sure that they are being cautious. So, this is not something that I have to really remind them or tell them about every day. While I'm speaking about my children in my family, certainly there may be different ways of approaching the pandemic for you and your family. We are here today to help educate you and for you to make that decision on your own of how you want to address this pandemic with your family. But you are also still able, and I encourage you, if you have questions for the school system, to please reach out to your elected school board members and also reach out to the school superintendent and make your questions or your concerns known. And you may also have access to the administration at your children's school, and you can share your concerns with them. But I do appreciate the opportunity to underscore that we are two separate jurisdictions, neither one of us having authority over the other. And thus, I am unable to direct any response of Cobb County Schools with respect to this pandemic.
Thank you very much, Chairwoman. And as we move on to our next question, I'd like to direct the next question to Dr. Branstetter. Dr. Branstetter, we received a question from someone who is a parent of small children, parent of very small children, young children who are not old enough to be vaccinated. They're under age 5. And so one of the questions has to do with, as a parent with small children who are not vaccinated, can you help guide and advise on how they should be protecting their children, because they may have family members or friends who are also unvaccinated? Would you give some guidance to those families of small children with regard to protecting their children when they may be around people who are unvaccinated?
It's a great question. It's a big concern. Certainly those who cannot get vaccinated, this includes those children less than 5 years of age, they're vulnerable. Fortunately, we are not seeing a huge amount of severe illness in the pediatric population. We do see it, but this is something that we are always concerned about, because the big humbling thing about COVID is we cannot predict who's going to have a severe complication. It's just not something that we know how to do and are able to do with great accuracy right now. So how to protect everyone, including those who cannot get vaccinated, is to make sure as many people are vaccinated as possible to reduce the spread in our community. Practice those 3 W's. Screen by testing if you're going to gather in large groups. And then certainly using the adage, if you feel unwell, stay away from those most vulnerable. So it's as you take and have those people who cannot get vaccinated, make sure that you're mindful of those. Other things to think about: meeting outdoors in the sunshine reduces the risk of transmission as well. Right now we're in the winter months. It's harder to do as cold weather is starting to strike us. So that is something that we can't do as easily right now, but it's something to consider. And then finally, for moms out there, if you're breastfeeding, you being vaccinated, producing antibodies on your own, you're going to get passive immunity to your youngest children. That is the other final way that you can help protect those who are most vulnerable.
Thank you very much, Dr. Branstetter. Our next question will be directed to Dr. Memark. Dr. Memark, what advice would you give for the situation where a person is vaccinated, but not yet with the booster, but they've been vaccinated, but no booster, and they've been sick, and now they've tested positive for COVID? The question is, how many more days do they need to quarantine before they can begin interacting with others?
Yeah, so this is a great question, and I'm not going to quiz people on all the stuff I went over before. So, but there's several things that come into play here. So, what kind of test they received. So, was it a PCR test or a rapid test? And the situation for this person. But, so the person that I'm reading the question on, they were actually sick for 10 days before they finally got a test. So, they should be okay at this point. So after 5 days, if your symptoms are improving, you don't have a fever, you can mask up and you can be out of your isolation, not the quarantine. But, just be careful though. If you were really, really sick and you're still, sounding just awful, or not, much improved. I would just be careful of those kind of situations. So for sicker people, it could be a little bit longer, but this person should be okay. So they were 10 days, they were sick. I'm assuming they were better. They finally got that test. I'm assuming it's a PCR, which lingers for a while. So you should be okay. So 5 days of improving symptoms, and then mask up though.
Thank you very much, Dr. Memark. The next question is for Chairwoman Cupid.
Yes.
So Chairwoman, this question is in regards to mask mandates within the county. So the question quite simply is, why aren't masks mandatory? How would you address that for us?
Thank you. I will speak first to our emergency order. The emergency order is something that I put in place as our COVID rates began to soar last year, December. Our emergency order encouraged response to that surge by encouraging everyone to get vaccinated, to avoid large crowds, and to also wear masks. Nonetheless, with that encouragement did not come a mandate for our facilities. And getting back to issues of jurisdiction, the operation or administration of business within our facilities falls within the sphere of our county manager, who then in response to that order put in a mask requirement for our facilities. Our facilities are under the control of Cobb County government. The order did not reach beyond that. We did what we could to protect people once they walk into our facilities. And so, again, for my actions, again, it was to encourage that. And I do appreciate our county manager being responsive by requiring masks.
Thank you, Chairwoman.
Mm-hmm.
Our next question will be to Lisa Crossman. Lisa, the question is in regards to long wait lines for testing, particularly in the Mableton area, but if you could speak to long lines for testing countywide, that would be helpful.
Of course, thanks for having me on tonight. So we saw in a period of about a week, a dramatic increase in demand in testing. One of our partners mentioned that they went from processing 15,000 tests in 1 week to over 100,000 tests the following week. And so because of that high demand and that very quick high demand, we had lines all over in our public and our private testing opportunities across the county, including our South Cobb area. It was difficult, it was irritating, and there wasn't any way to sugarcoat that. So the best that we can do is to say that we immediately responded by working with our partners and our staff and our Cobb County government police folks to increase our testing opportunities. We ramped up staff, we increased hours, and as Dr. Memark mentioned earlier, we launched 2 new sites at our Jim Miller Park and also up at our KSU BrandSmart location in partnership with them. I think that all of those actions in a period of about a week resulted in dramatically lowered wait times now at all of our sites. Most of the ones that I've checked on are seeing 15 to 20 minutes now these days with wait times. So again, my apologies for that early time on the waits, and hopefully we're not seeing that these days.
Thank you very much, Lisa. Our next question will be for Dr. Brandstetter. Dr. Brandstetter, as you're aware, as we're all aware, while many people are concerned about the virus and concerned about how to protect their families, there's also the other side of that coin where there are some people who are not, whose position is perhaps there really isn't a virus, perhaps it really isn't this dangerous, and are we really listening to the science or are we following some other narrative? Can you help to just address that there are multiple sides to how people are feeling about this virus, and what would you say to those who question whether or not we're actually listening to science or not?
Yeah, it's a great topic. I think one of the biggest things that we've had to face as a society is misinformation during this pandemic. I think that the rapidly changing information that we've discovered about COVID-19, new technologies that allow us to share information, has also contributed to a lot of different viewpoints being shared simultaneously. So there is a lot of confusion in our communities about how quickly things have changed, but also the number of viewpoints out there. So what can be done about this? Well, kudos to Cobb County and Chairwoman Cupid for hosting these town hall events to get good information out there to the community. This is one of the strongest ways we can do it, is band together, get information out there from a trusted source such as this. The other things is to find trusted sites that are available. I know Wellstar has committed a whole web page, as Stephen went over with you, for health information. So as our public health partners, they have websites for that have references linked that are verified information sites. And then finally, when you find that there's misinformation out there, please try to counter it by providing the other sources, and please do not spread misinformation. If you don't know if something's verified, take a second thought about before you share, post, retweet, etc. Can help with that. But it is a frustrating time. Again, I want to thank everyone for their patience, their understanding, and flexibility, because there's a lot of things changing rapidly, such as the isolation and quarantine times that the CDC just went through and updated. A lot of that's to keep people safe, keep our communities up and running, and our businesses also flourishing as well during this time. So thank you again for being flexible. It changes hard on all of us, and that also can help contribute to that.
Thank you very much, Dr. Renstetter. I'm going to move now to one of the questions that has come in since we started the town hall. And this question has to do with a parent of an 8-year-old, so a young child who got COVID over the holiday, and their child is not vaccinated. The question is there a time to wait to get vaccinated after having COVID, or should they go ahead and have their child vaccinated now? Dr. Brandstetter, can you respond to that one for us as well? Or would that be Dr. Memark?
Dr. Memark, can you take that one? They're probably tired of hearing me talk.
Yes, no. So they, can you repeat the question then?
Certainly. So parent of an 8-year-old who got COVID over the Christmas holiday. And the question is, and the child was unvaccinated. So the question is, how long should they wait to have the child vaccinated after they contracted COVID?
Okay, so that's a great question. So in this case, the children or whoever, so if you have already gotten COVID, when your symptoms improve, you can go ahead and get your vaccine. So I would wait the 5-10 days and you're safe to get the vaccine. You just don't want to have a whole lot of symptoms. So you probably wait the 10 days, you should be okay. Now, remember, now the child has been exposed or already had COVID, so there's not a rush to go ahead and do it. So, but you can go ahead and, after 5 or 10 days, you're safe to do it. You just don't want to have a whole lot of symptoms and be infectious and go to the clinic and possibly infect a bunch of other people. Does that answer
Thank
that?
you, Dr. Memark.
You're welcome.
The next question is, yes, thank you. The next question is in regard to the monoclonal antibody treatment. The question is that treatment considered effective for the Omicron variant?
Yeah, so there are 3 licensed or EUA monoclonal antibody treatment. One of those is effective against both Delta and Omicron. It's called Sotruvimab. It's made by GSK, and that is what we have available. It's very limited supply, but that is what we're currently using as well.
Thank you, Dr. Brandstetter. Chairwoman Cupid, a question for you. This is somewhat of a question and a suggestion, I think, from the public. The question is, can the county partner with the school district to provide at-home rapid tests for staff?
For Cobb County staff, I presume. That's an interesting question, and certainly we can reach out to them. And I can just let the public know that right now it is very difficult to get your hands on at-home rapid tests. And so this is something that's becoming an increasing concern, which is why I'm appreciative of the president's initiative to have tests delivered to persons at home. But until then, certainly we can see what opportunities become available to partner, because, I mean, as this pandemic impacts county employees, it impacts our schools. I mean, we're all here dealing with the same issue. So yes, that is an opportunity we can consider.
Thank you. Dr. Memark, this next question would be for you. You may have addressed some of this in your slide presentation, but the question is in regards to, if I have children who are not vaccinated, what guidance or advice would you give, especially in this time of rising cases, what guidance would you give with regard to us visiting other people, visiting other families, maybe even having play dates for our children? What guidance would you give for parents in that regard?
So that's a great question, and one that I kind of have to deal with all the time with my own kids. So first of all, if they're 5 or older, you should get them vaccinated. That's going to be the safest thing, first of all. And then, but I know how kids are, and they want to get together, and you also want them to get together with friends and be able to, you know, kind of have some normal childhoods, right? So things that you can do. So, you know, if your friends, I have to say this, if my kids, their friends are vaccinated, I feel a little bit better about them being able to hang out with a friend or two. So that's, I mean, that's just how it is, you know what I mean? If they maybe if they want to play with somebody that maybe isn't vaccinated, you know, you got to keep that really small, first of all, and then, you know, be safe about it. Nobody wants to wear their mask, probably, right? So, but if you can, that'd be the safest if you want to do something. But if you can do some outdoor activities, you know, I talked to my son, likes to fish and play soccer, and so I try to suggest that, you know, let's go outdoors, let's go to the park or go fishing or something like that, so that they're not inside next to each other playing video games or something like that. And this is just for the time being. It'll get better soon, but you know, just taking some of those precautions, getting tested yourself too, if you're going over to someone's house or you're going to visit older relatives or someone immunocompromised, you might want to run that rapid test just to make sure that nobody is inadvertently taking it over. Because I'm sure it's unpleasant to call another family or a family member and tell them that you tested positive for COVID right after you were at their house, right? So just thinking about those kind of things and what the next steps would be, I think would be helpful.
Thank you, Dr. Memark. One more question for Chairwoman Cupid. Chairwoman, this is in regards to the executive order that you've recently declared in December and the impact on aquatic centers. We had multiple questions from parents with athletes in the aquatic centers, and they are questioning the changes in the capacity limits. So can you just speak to, in some regard, those challenges that those parents may be dealing with, and maybe advise on how they can perhaps follow up and get more information with regard to those restrictions?
Thank you. We've been receiving ample correspondence from impacted families due to the limitations of capacity at our aquatic center. And that stems from the county manager's response to limit large gatherings at our facilities. And that's something that, again, recognizing she's doing that to address concerns about the high rise of COVID is something that I do understand and I support her in. But nonetheless, it has had a disparate impact on families who have children that swim at our facilities. Those that are involved in Cobb County School swim teams don't have pools that they can access through Cobb County Schools. So they are utilizing Cobb County government's aquatic centers for a lot of their swim meets. And as I stated at the top of this meeting, that because we are separate jurisdictions, some of the flexibility that has been provided at Cobb County Schools for their athletes does not correspond with the approach that we've taken here at the county with our facilities. Nonetheless, we've listened to parents, we understand their concern, and we've modified slightly the capacity of our aquatic centers as we didn't want to impact athletes' ability to participate in events, but it does limit the number of spectators that can watch athletes perform. And we're hoping that this will be for just the short time that we're experiencing this astonishing rise in our COVID numbers. We provided a case rate that's over 2,500 per 100,000 people. A high case rate is 100 cases out of 100,000 people. We are many times over that number. And so being responsive to protecting public health, we've just determined how we want to respond as a county. And so I'm asking for parents to please work with us and understanding that as we've been partners in allowing the swim teams to utilize our facilities, we need their partnership to help us bring these numbers down. And part of the way that we're doing so is reducing our large gatherings.
Thank you, Chairwoman. For our last question for tonight, I believe that perhaps this would be directed to Dr. Memark, and it's in regard to contact tracing. Dr. Memark, is contact tracing, can you speak to this? Is contact tracing still going on within the county? And is the health department in any way involved in that? There were several questions with regard to contact tracing and how that may be happening currently in the county or not happening.
So that's a great question, and I know that there's been some confusion about that. And so contact tracing is continuing in the county. Now, the cases are so extraordinarily high that it is impossible for our team, which is an expanded team, to be able to follow up on every single case. So, and the CDC has recommended not following individual cases of Omicron just because of the sheer numbers that we're looking at right now. My team from the health department, they are prioritizing the highest risk cases. And so we're looking at like when they happen in nursing homes or congregate facilities or in healthcare facilities or in schools or university settings. Those are the ones that they're trying to concentrate on the most due to how infectious Omicron is and how it can spread just very, very quickly. So we're trying to act upon those as quick as we possibly can. Some of you may have heard that the recent administrative order from Governor Kemp and Dr. Toomey gave the schools permission not to do the contact tracing if they were overwhelmed with cases. And so that is a school by school individual basis. And so we are supporting the schools as best we can. And so, I know that Cobb County Schools, we are helping them with outbreaks that they are having. And so we help them and we work with the Marietta City Schools and the Douglas County school systems to help them with whatever they need during this time, because they're seeing a lot of cases too during this current surge. So it is still happening, but it's prioritized at this time.
Thank you very much, Dr. Memark. And with that, Chairwoman Cupid, looking at our time, it's just about almost 7:30. I'd like to give you an opportunity to close us out. And I just wanted to take one more moment to say to our audience, because we continue to get more questions with regard to the school system. So just reminding everyone that the Cobb County Schools and Cobb County government are separate entities. But with that, Chairwoman, if you would like to close us out this evening, that would be great.
Thank you. First, I'd like to thank our panelists for today, Dr. Memark, Dr. Brandstetter, Lisa Crossman, Stephen Ball. Thank you for taking time out this evening to help to educate the public about the impact that this pandemic is still having on us, as well as arm us with information so that we can remain healthy or address any illness that we or others are experiencing with respect to the pandemic. Thank you for also helping to clarify just a lot of unknowns as things evolve. I also want to thank you, Yolanda, for helping to facilitate tonight's town hall. We could not have this without you helping to make sure things are up and running very well for us virtually. Lastly, I want to thank our public for tuning in tonight, for taking time out of your evening to understand more about how you can keep healthy and also keep your family healthy. My dog is chiming in as well. If you can hear him in the background, he's trying to tell you, Cobb County, to stay healthy, not only for you, but also for him. But with that, thank you all for your time. Again, we are in a new year, and while we still are dealing with some issues from last year, we can certainly change how we approach this by staying as informed as possible and doing the best that we can to protect ourselves. With that, I hope that every one of you have a great evening and a great rest of your week. Thank you. Take care.